Okay, so you miss your period, and your mind just starts racing, right? All these questions start popping up, and usually the next stop is the pharmacy for a home pregnancy test. That little plastic kit, it holds the potential for some really big news. But here's the thing, are you actually using it correctly? Today, we're going to cut through all the confusion and show you the right way to use a home pregnancy test so you can actually trust the result you see. This just says it all, doesn't it? It doesn't matter if you're hoping for a baby or not, that waiting game is just so incredibly stressful. Your mind is going a million miles an hour, and your first instinct is to find out, like right now. But that panic, that's exactly what leads to some major mistakes. And get this number, it's pretty wild. Over 90% of us, driven by that urgency and, just not having all the right info, make some really critical errors when taking a home pregnancy test. And that can lead to wrong results, a ton of unnecessary stress, and maybe even making decisions based on bad information. So let's fix that, starting with the biggest mistake of all. Okay, so here it is, the number one mistake people make, testing way too soon. Maybe it's right after intercourse or the very first day you expect your period. I get it, it feels like the logical thing to do, but biologically, it is almost guaranteed to give you an incorrect result. It's not magic, It's a chemical process that actually needs time to work. And here is the science behind why you've got to wait. See, pregnancy isn't instantaneous. After fertilization, the egg has to make this whole journey and implant itself in the uterine wall. It's only after that happens, that your body starts producing the pregnancy hormone, HCG. So the test isn't looking for a baby, it's looking for this specific hormone in your urine. So here's the golden rule for timing. If your cycle is pretty regular, you need to wait at least 5 to 7 days after your missed period. I know, that week can feel like an absolute eternity, but it's so important for those HCG levels to get high enough for the test to pick them up. Now, if your cycles are irregular, the guideline's a bit different. You'll want to wait 21 days after unprotected intercourse. Okay, so you did it. You waited the right amount of time. Awesome. But there's another really common trap, testing at the wrong time of day. And believe it or not, this can mess with the accuracy of your result just as much. The solution here is super simple. The absolute best time to test is with your first morning urine. Why? Well, after you've been sleeping all night, your urine is at its most concentrated. And that means the HCG hormone is also at its peak concentration, which makes it way easier for the test to detect. If you test later in the day, after you've had a bunch of water or coffee, you can actually dilute the sample and get a false negative. And a quick but really vital point on collection. The container you use has to be perfectly clean and dry. I'm talking not even a single drop of water or a tiny bit of soap residue. That stuff can contaminate the sample and totally interfere with a chemical reaction on the test strip, making your result completely unreliable. So, we've covered the when, and now let's dive into the how. If you want a result you can actually trust, you gotta follow these steps to the letter. This is the key. Okay, let's walk through the 5 steps for an accurate test. First, and this is easy to forget, always check the expiry date. Second, collect that first morning urine in a clean container. Third, lay the testing device on a flat surface. Fourth, and this is super, super important, use the dropper to add exactly 2 to 3 drops into the little sample well. Do not add more. It can flood the test and make it invalid. And finally, the hardest part, wait for a full 5 minutes without touching or moving it. Just let it do its thing. The 5 minutes are up. Your heart is pounding. You're almost afraid to look down at that little window. So what do those lines actually mean? Let's break it down so there's absolutely zero confusion. All right, think of this chart as your cheat sheet. The C line is the control line. It has to show up for the test to be valid. It basically just confirms the kit is working. So if you only see that one line on C, the result is negative. If you see 2 lines, one on C and one on the T for test line, that result is positive. And if no line shows up on C at all, the test is faulty, it's a dud, and you'll need to use a new one. Ah, yes, this is the one. This is the question that causes so much confusion and anxiety. You see that dark control line, but the test line, it's just this blurry, barely there shadow. What in the world does that mean? So here's the deal. The 2 most crucial things are timing and color. If a faint line that has some color, like pink or red, appears within that 5-minute window, it is 99% a positive result. It's just faint because your HCG levels are still low. The best thing to do is wait 3 to 4 days and test again. That line should be much darker. But if you look at the test after 10 or 20 minutes and see a colorless, grayish shadow, that's an evaporation line. It's like a chemical ghost. It means nothing and you should ignore it completely. Only the result you see within the 5-minute window is valid. All right, so no matter what result you see on that test kit, it's not the end of the story. It's really the beginning of the next chapter. And what you do next is the most important part of this whole process. If your result is positive, first things first, just take a deep breath. Your very next step should be to make an appointment with a doctor or a gynecologist. They can confirm the pregnancy and give you safe professional guidance. Now, if the result is negative, but your period still hasn't shown up, it's also really important to see a doctor. A missed period can be your body's way of telling you something else is going on, like stress or hormonal imbalances, and those are important to get checked out. And really, this is what it all comes down to. Your health is not something to guess about. Arming yourself with the correct information, that's how you take control. Hopefully, this explainer helps you face that little test with way more confidence and a lot less anxiety.